Hey guys, tonight we're going to talk about something truly grim. Something that would make your current visit to the doctor feel like a spa day. We're diving into why going to a barber surgeon sucked. Imagine a time when the person who trimmed your beard also pulled your teeth, set your broken bones, and even performed amputations. No sterile environment, no anesthesia. Just brute force and a prayer. This wasn't a choice. It was often your only option when illness or injury struck. And the results were, more often than not, utterly terrifying. Honestly, if you needed a medical procedure back then, you probably wouldn't survive the cure, let alone the original ailment. So, before you get comfortable, take a moment to like the video and subscribe, but only if you genuinely enjoy what I do here. And hey, let me know where you're listening from and what time it is for you. Now, dim the lights. Maybe turn on a fan for that soft background hum. And let's ease into tonight's journey together. You're standing in a bustling, often dirty, medieval European street. Your arm throbs from a nasty fracture, or perhaps a toothache has become unbearable. You look for a sign, and there it is, a pole painted with red and white stripes, sometimes with a brass basin hanging below. This is the unmistakable symbol of the barber surgeon, your local one-stop shop for everything from a haircut to a life or death operation. This isn't a highly trained physician. This is a craftsman, often illiterate, whose skills are learned through brutal apprenticeship rather than academic study. Consider the bewildering array of services he offers. You might step in for a quick shave. The glint of his razor dangerously close to your jugular. But that same razor, or perhaps a larger, blunter version, might then be used to perform bloodletting, a universal cure for almost everything, from fevers to melancholia. Imagine sitting there, a bowl strategically placed to catch your flowing blood, while the barber chatters away about the weather or the latest gossip. It's a multitasking nightmare, where hygiene is a foreign concept and versatility is king. He's literally a jack of all trades, master of none. Especially not sterile surgery. You observe him performing a tooth extraction. A peasant, their face swollen with infection, sits on a rickety stool. The barber surgeon produces a set of crude, heavy pliers, looking more like blacksmith's tools than medical instruments. There's no anesthetic, beyond perhaps a swig of ale or a stick for the patient to bite down on. With a grunt and a horrifying wrenching sound, the tooth is pulled, often bringing with it pieces of jawbone or neighboring teeth. The scream of the patient echoes through the small, unsanitary shop, a common soundtrack to this minor procedure. The pain is excruciating, and the risk of infection, often leading to a fatal abscess, is incredibly high. The scene then shifts. A man has a large, angry boil on his neck. The barber surgeon confidently takes a heated blade and lances it, allowing pus and blood to gush forth. This is not precision surgery, it's often a crude, painful incision, leaving a gaping wound highly susceptible to the myriad bacteria lurking in the shop's unwashed tools and the surrounding environment. The air itself is thick with the invisible agents of disease, ready to infect any open wound. One particularly horrifying duty was amputation. Imagine a soldier with a gangrenous limb, or a laborer with a crushed arm after an accident. The barber surgeon is called upon to remove the limb, often with terrifying speed. Using saws designed for wood, not bone, the patient, held down by assistants, endures unimaginable agony. The stump is then cauterized with a red-hot iron, not to prevent infection, but to stop the bleeding. A procedure as excruciating as the amputation itself. The survival rate for such operations was abysmal, not just from shock and pain, but from the almost inevitable infection that followed. Historians still debate the specific success rates of various barber surgeon procedures. But the lack of antisepsis meant that even successful operations often led to fatal complications. The very environment of the barber-surgeon's shop is a breeding ground for disease. You see dried bloodstains on the floor, unwashed instruments lying in piles, and possibly even a discarded limb in a corner. There's no understanding of germ theory, no concept of sterilization. The same uncleaned razor used for a shave might then be used to open a wound, carrying invisible killers from one patient to the next. The treatment you receive is often more dangerous than the original ailment. It's like going to a restaurant where the chef uses the same rag to wipe down the counter. The floor and your plate? Delicious. You're now moving from the gruesome general practice of the barber surgeon and into perhaps the most visceral reason why their services sucked. No anesthesia. Just agony. Imagine needing a limb set, a tooth pulled, or an abscess lanced, and the only pain relief offered is a swig of rough ale or a stick to bite down on. The screams of patients were not just common, they were the inescapable soundtrack to every medical procedure. A chilling testament to humanity's endurance in the face of unimaginable pain. Imagine yourself as a peasant with a broken leg, shattered after a fall from a horse. The pain is searing, bone deep, and unrelenting. You are brought to the barber-surgeon's shop, your body trembling with agony and fear. The barber-surgeon, perhaps a burly individual with calloused hands, prepares to set the bone. There's no gentle numbing injection, no gas to lull you into unconsciousness. You are simply held down, often by several strong assistants or even concerned family members, while the barber surgeon manipulates your broken limb back into place. The crack of bone, the tearing of muscle, and your own guttural screams fill the small, unsanitary room. This isn't just pain, it's a profound, raw agony that leaves you gasping for breath. Your mind reeling from the sheer intensity of the sensation. It's like experiencing every nerve ending in your body screaming at the exact same moment. And you can't escape it. Consider the various pain management techniques, none of which were truly effective. You might be offered a strong alcoholic drink, perhaps a crude wine or ale, to dull your senses, but this would only provide a fleeting, inadequate haze, doing little to truly block the intense pain. Sometimes, opium or mandrake root concoctions were used, particularly for the wealthy, but these were often unreliable, difficult to dose correctly, and could induce dangerous side effects, sometimes even causing death themselves. For the vast majority, it was simply raw, unmitigated suffering. You observe a woman with an infected tooth, her face swollen to twice its size. The barber surgeon approaches with his fearsome pliers. She knows what is coming. She clamps her jaws shut, perhaps digging her fingernails into her palms. The moment the tool connects with her tooth, a piercing scream erupts, echoing the cries of countless patients before her. Her body arches, struggling against her restraints. As the tooth is wrenched from her jaw, the bleeding, the lingering pain, and the trauma of the experience would stay with her long after the tooth was gone. The emotional scar of such agony was often as profound as the physical one. One particularly grim detail is the speed at which procedures were often performed, not out of compassion for the patient's pain, but out of necessity. The faster the operation, the less time for the patient to struggle, to go into shock, or for the surgeon to make a mistake. Amputations, for instance, were often completed in mere minutes, a blur of saw and knife. Not because of skill in preventing pain, but because prolonging the agony risked the patient dying from shock before the operation was even finished. Historians still debate the specific techniques used to increase speed in surgeries, but the focus was undoubtedly on minimizing the time spent under excruciating conscious pain. The very concept of pain was different. Without understanding of the nervous system or effective analgesia, Pain was often seen as an unavoidable part of life, a test of fortitude, or even a divine punishment. There was less emphasis on relieving it and more on simply enduring it. This cultural acceptance of suffering, born from necessity, meant that agonizing procedures were simply part of the grim reality of medical care. You were expected to bear it, no matter how excruciating. You notice how the lack of anesthesia impacted the very types of operations that could be performed. Complex internal surgeries were largely impossible, even if a surgeon knew the anatomy. The patient simply couldn't endure the prolonged agony. This limited medical interventions to external procedures, setting bones, lancing boils, amputating limbs, which, while brutal, could at least be done quickly enough for the patient to survive the immediate shock. The grim spectacle of surgery was often public knowledge. The screams from the barber-surgeon's shop would carry through the streets, a chilling reminder to passers-by of the horrors within. This added another layer of terror for anyone contemplating seeking their services. You knew what awaited you. You had heard the sounds. The dread itself would be almost as unbearable as the pain. You're now moving from the visceral agony of surgeries without anesthesia and into an even more insidious, pervasive misery that defined the barber-surgeon's practice: filth, infection, and fatal fates. Imagine a medical environment where the very act of seeking help increased your chances of dying, not from your original ailment, but from the invisible killers lurking on unwashed hands, dirty tools, and stagnant air. This wasn't just poor hygiene, it was a fundamental ignorance of disease that turned every procedure into a deadly gamble. Imagine stepping into the barber-surgeon's shop. The floor might be covered in sawdust to absorb blood and other fluids, but it's rarely, if ever, truly cleaned. The air is thick with the smells of human sweat, unwashed bodies, stale ale, and the metallic tang of dried blood. Dust motes dance in the shafts of light, each one a potential carrier of unseen pathogens. There's no running water, no soap as you know it, and certainly no concept of antiseptics or sterilization. Every surface, every cloth, every tool is teeming with bacteria and other microorganisms. Microscopic armies waiting to invade any open wound. It's like getting surgery in a dumpster. But the dumpster is also your barber shop. Consider the absolute lack of hygiene in surgical procedures. The barber surgeon might wipe his blade on his apron, or perhaps on a convenient piece of cloth that has already been used on multiple patients. The same unwashed hands that just shaved a beard, applied a poultice, or emptied a chamber pot, are then plunged into an open wound. You observe him lancing an abscess, the pus and blood oozing onto his uncleaned tools, which he then uses for the next patient without a second thought. This wasn't negligence in a malicious sense. It was simply the accepted standard of care in a world utterly ignorant of germ theory. The idea that invisible animal coolies could cause disease was centuries away from widespread acceptance. You observe the horrifying, almost inevitable consequences. A simple cut, a tooth extraction, or even a basic bloodletting procedure often led to a much more terrifying complication infection. The wound, left open to the teeming bacteria, would quickly become red, swollen, hot, and intensely painful. Pus would form, sometimes leading to a rapidly spreading infection known as sepsis. You might see a patient, seemingly recovering from an initial injury, suddenly develop a high fever, chills, and delirium, their body shutting down as the infection overwhelmed their system. For many, the barber surgeon's cure was a direct pathway to a slow, agonizing death. One particularly grim reality was the mortality rate from infection. For centuries, more people died from post-operative infections than from the initial injury or disease. A broken leg set by a barber surgeon, while physically corrected, often resulted in gangrene, requiring a desperate, often fatal, amputation. A tooth pulled to relieve pain frequently led to a spreading facial abscess that could eventually reach the brain. This statistical reality, though unknown to the people living through it, underscores the extreme danger of seeking medical intervention in a pre-antibiotic, pre-hygiene era. Historians still debate the precise proportion of deaths directly attributable to post-surgical infection versus other causes in the medieval and early modern periods. But its significant contribution to mortality is universally recognized. The barber surgeon himself was constantly exposed. He moved from one infected patient to another, carrying pathogens on his clothing, his hands, and his uncleaned instruments. He himself was highly susceptible to the very diseases he treated, and many barber surgeons died prematurely from infections contracted on the job. He was both the purveyor of pain and the unwitting carrier of death. A grim paradox of his profession. You notice the despair that must have set in when a patient, having endured excruciating pain for a procedure, then watched themselves succumb to a worsening secondary illness. The feeling of being betrayed by the very person meant to help, of having faced agony for naught, must have been utterly soul-crushing. The healing often felt like a cruel irony, a prelude to a more protracted and often inevitable demise. You're now moving from the sickening reality of infection and into the grim gallery of tools of torture. Not healing. Imagine needing medical attention in a time when the instruments used to cure you looked more like implements of medieval torture than precision surgical tools. This wasn't just about discomfort, it was about crude, terrifying implements designed for brute force, leaving you wondering if the treatment itself was a form of punishment. Imagine you're sitting in the barber-surgeon's chair, a cold dread creeping up your spine as he lays out his implements. You see things that look suspiciously like carpentry tools heavy, rusted iron pincers, resembling a blacksmith's tongs, designed for pulling nails, not teeth. There are crude, saw-like knives, dulled with use. Their blades stained brown, perhaps a heated cautery iron. Its tip blackened from previous applications. Sits menacingly over a small flame. These aren't the gleaming, sterile scalpels and forceps you might imagine. These are the brutish instruments of a desperate trade, crafted for efficacy in a pre-scientific age. Not for patient comfort or safety. It's like going to a fancy modern restaurant, and the chef pulls out a chainsaw to carve your chicken. Consider the pelican for tooth extraction. This terrifying device, named for its supposed resemblance to a pelican's beak, was essentially a claw on a pivot, designed to grasp a tooth and then leverage it out of the jaw. Imagine the sheer mechanical force, the tearing of gum and bone. As this crude tool was applied, the patient's head would be held firmly, often by an assistant, while the barber surgeon applied immense pressure, wrenching the tooth free with a sickening crack. The goal was simple extraction, not preservation or gentle removal. The pain, as we've discussed, was agonizing, and the collateral damage to surrounding teeth and jawbone was incredibly common. You observe the amputation saw for shattered limbs or gangrenous extremities. The only cure was often removal. The saw used for this grim task was not the fine-toothed surgical instrument of later centuries, but a coarse, heavy saw, similar to those used by carpenters. Imagine the rough teeth tearing through flesh, muscle, and bone, the bone dust mingling with blood and tissue. The speed of the cut was paramount, not for patient comfort, but to reduce the time the patient was conscious in agony and to minimize blood loss. The sheer barbarity of the tool itself speaks volumes about the level of suffering involved. One particularly disturbing detail is the lack of standardization or sterilization. Each barber surgeon might have their own set of tools, handmade and unique, often passed down through generations. These instruments were rarely cleaned beyond a cursory wipe, and certainly never sterilized. The same tools used to cut an abscess might then be used to set a bone, carrying infection from one patient to the next. The instruments themselves were silent conduits of disease, turning every intervention into a roll of the dice with deadly pathogens. Historians still debate the specific types and variations of tools used by barber surgeons across different regions. but the overarching lack of sterile practice is universally acknowledged. The practice of bloodletting involved specialized, but equally crude, tools. You might see a fleam, a small sharp blade designed for making quick, deep incisions in veins, or a set of scarificators. Small spring-loaded devices with multiple blades that would make numerous tiny cuts for cupping. The blood would then be collected in a bowl, often the same bowl used repeatedly, unwashed, for multiple patients. The simplicity of these tools belied their potential for harm, making a common cure a significant risk for infection and excessive blood loss. You notice how the very design of these tools reflected the underlying medical philosophy, that the body was a series of tubes and humors that needed to be opened, drained, or manipulated with brute force. There was no concept of delicate internal structures or microscopic threats. The tools were extensions of the barber-surgeon's strength, not of a precise scientific understanding of anatomy. It's a powerful visual reminder of how far medicine had to evolve from a craft based on brute force to a science based on precision and sterility. You're now moving from the terrifying tools of the barber-surgeon and into a particularly pervasive, often harmful, and universally applied remedy that defined early medical practice, bloodletting the pervasive practice. Imagine feeling unwell, and no matter what your symptoms, a fever, a headache, a cough, or even a broken limb, the immediate solution offered is to cut you and drain out some of your blood. This wasn't just a treatment, it was a fundamental medical philosophy, applied with unwavering conviction. Despite its often disastrous effects, imagine yourself as a nobleman in 15th century France, feeling a persistent fever and a dull ache in your joints. You summon the barber-surgeon. He doesn't examine your throat or listen to your chest. Instead, he immediately prepares for a bloodletting. You recline, perhaps on a crude bench, as he selects a vein. Often in your arm or neck, he produces a sharp lancet or a small blade called a fleam. With a quick, precise cut, your blood begins to well up, flowing into a bowl placed conveniently nearby. This isn't a trickle, it's a steady stream, sometimes for minutes, as the barber-surgeon watches the color and consistency of the blood. Looking for imbalances, consider the underlying theory. For centuries, Western medicine was dominated by the humoral theory, which posited that the human body contained 4 essential fluids, or humors blood: phlegm, yellow bile, and black bile. Illness was believed to be caused by an imbalance or excess of these humors. If you had a fever, it was likely an excess of hot blood. If you were melancholic, it was too much black bile. Bloodletting, therefore, was seen as a logical and essential way to restore this balance. To literally drain away the excess humor and bring the body back to health. It's like trying to fix an overflowing sink by just letting the water run. Even if the pipes are completely clogged, you observe the sheer ubiquity of the practice. Bloodletting wasn't reserved for specific ailments, it was a universal panacea, applied for almost every known disease or condition. You might undergo bloodletting for headaches, fevers, infections, inflammation, mental illness, and even for minor injuries. Pregnant women were bled. Infants were bled. The elderly were bled. It was seen not just as a cure, but as a preventative measure, a way to maintain health by regularly purifying the blood. Imagine a time when a routine checkup might involve deliberately losing a pint of your vital fluid. One particularly terrifying aspect was the risk of excessive blood loss. Without modern understanding of blood volume, anemia, or the circulatory system, barber-surgeons could inadvertently bleed patients to the point of severe weakness, shock, or even death. Imagine feeling faint, dizzy, and clammy after a lengthy bloodletting. Your body struggling to cope with the sudden loss of a vital fluid. This weakness, often misattributed to the disease itself, only made patients more susceptible to other illnesses and slowed their recovery. Historians still debate the specific instances where bloodletting definitively worsened patient outcomes versus cases where it had a neutral effect. But its potential for harm from excessive blood loss is universally acknowledged. The instruments for bloodletting were crude but effective in their purpose. Besides the lancet and phleem, you might see cupping glasses, heated to create a vacuum, then placed on the skin to draw blood to the surface, wet cupping, or simply to produce bruising, dry cupping. Leeches, too, were widely used, applied directly to the skin to suck blood. Seen as a more gentle form of phlebotomy, imagine the disconcerting sight of slimy, wriggling leeches attached to your skin, slowly engorging themselves on your blood. The public perception of bloodletting was complex, while often terrifying. It was also seen as a necessary and deeply ingrained medical procedure. Patients expected it, and physicians prescribed it with confidence. The sight of blood, rather than inspiring horror, often brought a strange sense of relief, a belief that the bad humors were leaving the body. This psychological effect, combined with the occasional self-limiting nature of diseases, sometimes created the illusion of success. Reinforcing the practice for centuries, you're now moving from the seemingly ubiquitous practice of bloodletting and into a more specific, yet equally agonizing, domain of the barber surgeon: dental extractions, a tooth for a life. Imagine living with a toothache so severe it makes you weep, knowing that your only recourse is a visit to someone whose primary skill with teeth involves wrenching them out with tools that look like they belong in a blacksmith's forge. This wasn't a gentle dental visit, it was a brutal, often traumatic, and potentially fatal ordeal. Imagine yourself as a peasant, perhaps in a bustling 16th century market town, your jaw throbbing with a tooth infection that has spread to your cheek, making eating and sleeping impossible. The pain is relentless, a constant, gnawing agony. You spot the red and white striped pole, and with a mix of dread and desperation, you enter the barber-surgeon's shop. There's no separate dental suite, no calming music. Just the usual smells of blood, unwashed bodies, and stale beer. You sit on a simple wooden stool, your body tensed, knowing what's coming. Consider the instruments. The barber-surgeon pulls out a pair of dental pliers, often made of crudely forged iron, looking more like a blacksmith's tongs than a delicate surgical tool. Some might even resemble a large pair of pincers, designed for pulling nails, not teeth. There's no ergonomic handle, no fine precision, just brute strength. He doesn't offer a numbing gel or a local anesthetic. Instead, you might be given a leather strap to bite down on, or perhaps a swig of strong, cheap ale which offers only the slightest dulling of the edge. It's like preparing for a wrestling match with your own mouth, and your opponent has a very large, very blunt wrench. You observe the procedure. The barber-surgeon grips the offending tooth. You feel the immense pressure, the terrifying sense of the tool crushing against your jaw. Then, with a grunt and a horrifying wrenching motion, he twists and pulls. You hear a sickening crack as at the tooth, or your jawbone. The pain is instantaneous, searing, and absolute. A piercing scream rips from your throat, mingling with the sounds of your struggle. Blood gushes, often filling your mouth, hot and metallic. The tooth, or what's left of it, might come out, sometimes with fragments of bone attached, or sometimes the tooth itself shatters, leaving jagged pieces in your gum. One particularly grim reality was the high risk of complications. The extraction itself was traumatic, often leaving a gaping wound highly susceptible to infection. Without any understanding of sterile technique, the barber-surgeon's unwashed hands, unsterilized tools, and the unsanitary environment of his shop were teeming with bacteria. A successful tooth extraction often led to a secondary infection, a spreading abscess that could travel to your jawbone, your sinuses, or even your brain, leading to a slow, agonizing death from sepsis. The very act of seeking relief from pain often initiated a more deadly, protracted suffering. Historians still debate the specific mortality rates for medieval dental extractions, but contemporary medical texts often describe fatal complications. Highlighting the extreme risk, the psychological impact of such an experience would be profound. The memory of the searing pain, the sound of your own screams, the blood, and the feeling of helplessness would likely stay with you for a lifetime. The fear of future toothaches would be overwhelming, perhaps leading you to endure unbearable pain rather than face the barber-surgeon's chair again. This cycle of fear and untreated pain was a common, brutal reality for millions. You notice the lack of post-extraction care. There's no advice on how to keep the wound clean. No pain medication. No warning about potential swelling or fever. You are simply dismissed. Perhaps with a wad of cloth to bite on to stop the bleeding. Left to suffer the aftermath in silence. Hoping that the wound doesn't fester and claim your life. Your only solace is that the original, unbearable toothache is finally gone, replaced by a new, fresh pain that, for a time, feels like a blessed relief. You're now moving from the agony of dental extractions and into perhaps the most dramatic, yet equally brutal. Procedure performed by the barber-surgeon. Amputations, a last resort's horror. Imagine a world where losing a limb meant not just a life-altering disability, but a terrifying dash for survival against overwhelming odds. All performed with crude tools, no effective pain relief, and a terrifyingly high chance of dying on the table. Or, shortly thereafter, from infection, imagine yourself a soldier wounded on a medieval battlefield, your leg shattered by a mace, or a civilian whose arm has been crushed by a collapsing building. The limb is mangled, perhaps already showing signs of gangrene blackening. Foul-smelling tissue, a clear sign of impending death. Your only hope of survival, a desperate gamble, lies with the barber-surgeon. He's not in a sterile operating theater, he's likely in a makeshift tent near the battlefield. Or his usual shop, surrounded by the usual filth. This isn't surgery as you know it, it's a terrifying race against the clock. A brutal act of dismemberment to save a life. If you're lucky, consider the preparation. There's no general anesthetic to render you unconscious. You are given a strong swig of brandy or opium, if available, but for the most part, you are fully conscious, or at least dimly aware. Of the horror about to unfold, you are held down, often by several burly assistants, or even fellow soldiers, who must restrain your struggles as the agonizing pain begins. The surgeon might tie a tourniquet tightly around the limb, high above the injury, to stem the gushing blood. A painful constriction in itself. It's like being strapped to a table. Fully aware, while someone prepares to cut off a part of you, you observe the horrifying speed and brutality of the procedure. The barber-surgeon picks up his amputation saw, a tool that looks more suited for cutting firewood than human bone. With terrifying efficiency, he begins to cut through flesh, muscle, and finally bone. You hear the sickening crunch as the saw tears through tissue, the scraping sound against bone, and your own guttural screams rip through the air. The speed is crucial, a skilled, or rather, fast. Barber-surgeon could perform an amputation in minutes. This speed isn't for your comfort, but to reduce the time you spend in shock and to minimize blood loss. As every drop is precious, it's a gruesome ballet of necessity and agony, where the choreography is dictated by the fear of immediate death. Once the limb is severed, the horror is far from over. The severed arteries and veins are still gushing blood. The barber-surgeon's next task is to stop the bleeding, often by applying a red-hot cautery iron directly to the stump. You hear the hiss of searing flesh, smell the burning tissue, and experience another wave of unimaginable pain as the heat sears your nerves. This wasn't just barbaric, it was excruciating. A secondary torment designed to seal the wound and prevent immediate death from hemorrhage. One particularly grim reality was the abysmal survival rate, even if you survived the immediate shock and blood loss. The chances of dying from infection were incredibly high, without antiseptic techniques. The raw stump was an open invitation to the myriad bacteria on the surgeon's unwashed hands, his unsterilized tools, and the filthy environment. Gangrene would often set in, spreading rapidly, leading to a slow, agonizing death. Most patients who underwent amputations did not survive for long. Historians still debate the specific long-term survival rates for amputees in the pre-modern era, but the immediate post-operative mortality from infection was undoubtedly the most significant factor in patient death. The psychological trauma of enduring such an operation, often fully conscious, would be lifelong. The phantom limb pain, the nightmares, the physical disfigurement, and the constant memory of the agony would haunt the few who survived. Living as an amputee in a world without prosthetics or adequate support was a profound misery, often condemning individuals to a life of begging or complete dependence. You're now moving from the visceral horror of amputations and into the grim reality of how these medical professionals came to be the barber's bloody apprenticeship. Imagine entrusting your life, or your limb, to someone whose training involved no formal education, no scientific understanding, and certainly no sterile labs, but rather brute force, observation, and learning directly at the side of a master who was just as likely to cause harm as to heal. Imagine yourself as a young boy in 15th century Europe, too poor for a university education but needing a trade. You are apprenticed to the local barber surgeon. Your training doesn't involve anatomy textbooks or lectures on pharmacology. Instead, your days are spent sweeping the shop floor, sharpening instruments, often crude ones, cleaning up blood, and holding down screaming patients during agonizing procedures. You learn by watching, by doing, and by enduring. This isn't a structured curriculum, it's a trial by fire. Or more accurately, a trial by blood and pus. It's like learning to fly a plane by watching someone else crash, and then being told. Your turn, consider the sheer lack of theoretical knowledge. Your master, the barber-surgeon, likely can't read Latin texts on ancient medicine. Even if he possessed them, his understanding of the human body is based on practical, often flawed, observation. He knows where to cut to make blood flow, where to pull to extract a tooth, or how to roughly set a bone. But he has no concept of the circulatory system, no understanding of germ theory, and only a rudimentary grasp of anatomy gleaned from limited dissections often illegal or performed on executed criminals. This profound ignorance of underlying biological processes meant that even well-intentioned interventions were often blind gambles. Historians still debate the specific curriculum, or lack thereof, in barber-surgeon apprenticeships versus the practical skills acquired, but the emphasis was undeniably on manual dexterity over intellectual understanding. You observe the brutal hands-on learning. Your first tasks might involve holding limbs steady during an amputation, feeling the raw power required to saw through bone. You might then progress to preparing poultices, mixing concoctions, and eventually, performing simpler tasks like applying leeches or lancing small boils. The learning curve is steep and unforgiving, with every mistake potentially costing a patient's life, or at least inflicting excruciating pain. There's no simulator, the operating table is your classroom, and the patient is your unwilling dummy. One particularly disturbing aspect is the inheritance of flawed practices, because training was anecdotal and practical rather than scientific and theoretical. Erroneous beliefs and dangerous methods were passed down through generations. If a master believed that bleeding cured all ills, his apprentice would learn to bleed everyone. If he performed a certain type of amputation that often resulted in death, that technique would continue to be taught, simply because that's how it's done. There was no mechanism for widespread critical evaluation or improvement based on empirical evidence, leading to centuries of perpetuated medical ignorance. The lack of formal regulation meant that anyone who completed such an apprenticeship, however crude, could set up shop. There were no licensing boards, no standardized exams, no oversight to ensure a minimum level of competency or safety. This opened the door for varying degrees of skill and, in some cases, outright quackery, further contributing to the inherent risks of seeking medical treatment. You were literally putting your life in the hands of someone whose qualifications were largely self-proclaimed or based on a dubious lineage. You notice the psychological desensitization that must occur. To endure and perform such gruesome tasks day after day, year after year, required a profound detachment from human suffering. The screams, the blood, the dying faces, these became part of the everyday routine. The barber-surgeon and his apprentice had to develop a hard exterior, a cold resolve, to perform their duties. This emotional hardening was a necessary survival mechanism, but it undoubtedly came at a personal cost. You're now moving from the crude training of the barber's bloody apprenticeship and into a realm where desperation met credulity, quackery, superstition, and dubious cures, when medical science offered little understanding and even less effective treatment. A vacuum was created, eagerly filled by charlatans, folk healers, and bizarre remedies that blended ancient beliefs with outright deception. Your chances of getting better from one of these cures were slim to none. And often, they made things much, much worse. Imagine yourself in a bustling medieval fair or a crowded street corner in a plague-stricken town. A flamboyant figure stands on a makeshift stage, loudly proclaiming his miraculous abilities. He's a traveling quack doctor, often adorned in flashy clothes, hawking his cure-all elixirs. He holds up a brightly colored bottle, promising to banish fevers, soothe pain, and even ward off the plague itself. The air around him is thick with the desperate hope of the ailing, drawn by his confident pronouncements and theatrical showmanship. This isn't about scientific medicine, it's about exploiting fear and ignorance for profit, offering snake oil where true healing is needed. It's like a really bad infomercial, but instead of just wasting your money, you might lose your life. Consider the sheer variety of dubious cures and bizarre ingredients. You might be offered a potion containing powdered mummy, ground-up pearls, dried toad, or even animal excrement. These concoctions were often based on sympathetic magic of yee, using something dark to cure a dark disease or the belief that rare and expensive ingredients must be powerful. Imagine being told to swallow a bitter, foul-smelling liquid made from pulverized unicorn horn, convinced it holds the key to your survival. Many of these remedies were inert, but some were actively harmful, containing toxic substances like lead, mercury, or arsenic, exacerbating the patient's suffering or leading to poisoning. You observe the blending of superstition with rudimentary medical practices. Folk healers might advise you to carry specific amulets, wear garlic around your neck, or sleep with a raw onion under your pillow to ward off illness. These practices, while harmless in themselves, offered a false sense of security, distracting from any potentially useful if unproven treatments. They reflected a deep-seated belief in magical protection and the power of symbolic gestures against an invisible enemy. Historians still debate the extent to which these folk remedies had any placebo effect versus being entirely ineffective. But their widespread use highlights the desperation of the populace. One particularly insidious aspect was the exploitation of desperation. During epidemics, when traditional medical authorities seemed helpless, people were willing to try anything. Quacks and charlatans flourished, preying on the terror and vulnerability of the sick and their families. They charged exorbitant prices for their useless remedies, draining the meager resources of the poor and leaving them with false hope and empty pockets. This wasn't just a lack of efficacy, it was often a cruel form of economic predation, capitalizing on human misery. You might encounter cures that involved painful or uncomfortable rituals. Some might suggest rubbing a living animal like a chicken or a pigeon against the buboes of a plague victim, believing the animal would draw out the disease. Imagine the sick, already in agony, subjected to such strange, often frightening, procedures, adding to their physical and psychological distress. These were not gentle interventions. They were often invasive and unsettling. Based on a profound misunderstanding of biology, the lack of regulation and oversight allowed these dubious practices to thrive. There were no medical boards, no consumer protection agencies, no scientific bodies to evaluate claims. The barber-surgeon, himself often operating on rudimentary knowledge, could not effectively combat the pervasive influence of charlatans who promised immediate, miraculous cures where he could only offer pain and uncertainty. This unchecked proliferation of quackery meant that genuine, if limited, medical progress was often drowned out by the noise of sensationalist claims. You notice how the language of these quack doctors often mirrored that of legitimate for the time practitioners, using obscure Latin phrases or pseudoscientific jargon to impress and confuse. They were masters of rhetoric, able to tap into the deepest fears and desires of their audience, promising relief and salvation where none was truly possible. This linguistic deception further blurred the lines between genuine care and outright fraud. You're now at the final step of our journey through why going to a barber surgeon sucked, bringing us to a reflection on the grim trade of a gory profession. This wasn't a glamorous job, it was a deeply unpleasant, often reviled, but utterly indispensable profession that highlights humanity's desperate struggle against illness and injury in a world devoid of true medical science. The barber surgeon, with all his crude tools and limited knowledge, was a mirror to a society grappling with mortality, necessity, and the agonizing distance between aspiration and capability. Imagine yourself in a medieval or early modern town when illness struck or an accident occurred. You didn't have the luxury of choice. The university-trained physicians were for the elite, focused on theoretical medicine and humors, often disdaining manual procedures. So, for the vast majority of the population, the barber surgeon, despite all his terrifying drawbacks, was your only hope. He was the most accessible, and often the most affordable option. This economic and practical reality underscored the grim necessity of his trade. He sucked, yes, but he was your sucky option. Consider the social standing of the barber surgeon. He occupied a strange, often contradictory, position in society. On one hand, he was vital. He performed procedures that literally saved lives, however rarely or brutally, or offered relief from excruciating pain. He was a practical man, a craftsman who dealt with the raw realities of the human body. On the other hand, he was often seen as unclean, associated with blood, disease, and the grim aspects of human suffering. He was a manual laborer, not an intellectual, and his profession was often looked down upon by the more esteemed physicians. This dual perception meant he was both needed and disdained, a constant reminder of humanity's vulnerability. You observe the physical hallmarks of his trade that became iconic. The barber's pole, with its red and white stripes, directly symbolized the two main functions: red for bloodletting, white for bandages, or sometimes a spiraling blue for veins. The brass basin at the bottom was for catching blood. This public display, once a common sight, is a stark visual shorthand for a time when barbers and surgeons were one and the same, their functions gruesomely intertwined. It's a bit like seeing a modern dentist with a giant bloody tooth hanging outside his office. One particularly grim aspect was the constant exposure to suffering and death. The barber surgeon lived and worked amidst agony. His shop was a place of pain, his hands constantly stained with blood and bodily fluids. He witnessed immense suffering, irreversible injury, and countless deaths. This constant immersion in human misery undoubtedly took a profound psychological toll. hardening him to the sights and sounds that would send others fleeing. He was a necessary evil, perhaps, but a human being burdened by the realities of his profession. Historians still debate the specific emotional coping mechanisms barber-surgeons might have developed, but a certain level of detachment was likely essential for survival in their gruesome trade. The economic reality, while providing a living, was often precarious. Fees were paid per procedure, and some services, like setting bones or amputations, were expensive, but the consistent demand meant a steady, if grim, income, however. They also risked losing customers if their reputation for botched procedures became too widespread, or if a plague wiped out their clientele. It was a brutal form of free market capitalism applied to human health. You notice the quiet, often unacknowledged, bravery of the barber-surgeon. Despite the lack of knowledge, the primitive tools, and the constant threat of infection, they still performed their duties. They faced diseases they didn't understand and injuries they could barely comprehend, often putting themselves at immense risk. Driven by a combination of necessity, professional pride, and perhaps a genuine desire to alleviate suffering, however imperfectly, they were working with the best available knowledge and tools of their time. Limited as they were, the legacy of the barber-surgeon is complex. He represents a brutal, pre-scientific era of medicine, a stark contrast to the sterile, specialized medical care we know today, but he also represents the unwavering human need for healing, the persistent demand for intervention, no matter how painful or dangerous. He was a foundational figure, a grim stepping stone in the long, arduous journey of medical progress. His misery, and the misery he inflicted, ultimately paved the way for a better understanding of the human body and, eventually, a kinder, more effective path to healing, as the echoes of the barber-surgeon's grim trade gently dissolve into the quietude of your room. Let your mind drift away from the jarring sounds of saws and the faint smell of antiseptic. Feel the subtle tension in your thoughts ease, imagining the long, arduous path of human healing, once brutal, now softened by centuries of knowledge. The journey through bloodied poles and desperate cures, through pain and perseverance, has reached its gentle conclusion, leaving you in the serene stillness of your own space. The flickering images of suffering and rudimentary care, of relentless dedication and slow progress, are now fading into a tranquil calm. Let the soft hum of the fan, or the serene silence of your room, guide you deeper into profound relaxation. There's nothing left to fear. No agonizing procedure to endure, no crude tool to wield, just the peaceful rhythm of your own breath, easing you further and further into a restful slumber. Let the last remnants of our historical dive into medical misery gently merge with the shadows of the night.